I've definitely seen many psychological conditions benefit from massage, from depression to anxiety to postpartum depression. Also, post concussion syndrome is another big one.
Greetings, hello, good day. I want to welcome you to the Truehope Canada podcast, Truehope Cast. My name is Simon. I'm going to be your host. Truehope Canada is a mind and body based supplement company that is dedicated first and foremost to promoting brain and body health through non-invasive nutritional means and more. Now than ever, people are looking for ways to support their brain health, and this is a huge part of what we're trying to do at Truehope Canada. Our current series of episodes on this podcast are discussing how different therapists and practitioners are applying their profession towards mental health. For more information about Truehope Canada, you can visit us at truehopecanada.com, and you can also find us on all the usual social media sites: Facebook, Instagram, Twitter, MeWe, etc. Just search for Truehope Canada and you will be connected. We've got another lovely guest with us today, registered massage therapist Kayla Ruddock, and we're going to be talking about how professional massage engages with the nervous system to support mood disorders such as anxiety and depression. Kayla works and practices in Kamloops, British Columbia. She's also a yoga teacher and a birth doula. Kayla graduated from the West Coast College of Massage Therapy in 2010, worked in Vancouver for 4 years, and now works and practices in Kamloops. Kayla's got a love for further educating herself as she continues her understanding of human anatomy and physiology, and has a focus within her practice in craniosacral techniques, visceral manipulations, and myofascial therapy. Kayla's fascinated by the human form and its capacity for homeostasis and healing. She feels incredibly honoured to have a career in manual therapy and support her clients on their path to wellness. So, first of all, Kayla, thank you so much for being with us today. And my first question, as always, is how are you?
Hi, Simon. It's a pleasure to be here. And actually, I'm quite wonderful today. How are you?
I'm doing good. We've had a lovely bit of snow, and we've got this really funky sunlight, cloud, snow situation happening here in Kamloops today. And considering I've only been living here for a few weeks, I've seen about 50 different types of sky out there, and it's really beautiful to be here. So why don't you tell us a little bit about you, your journey into becoming a therapist and a healer?
Yeah. So I feel pretty blessed by the fact that massage therapy was a calling for me. I think I was 11 or 12 years old. I didn't even know what a massage therapist was. And that's what I wanted to be. I was in a high school play and they had a write-up on all the actors. And I still have the little play script that said Kayla Ruddock would like to be either a professional piercer or a registered massage therapist. And I've followed that dream, and I am so glad I did. It's been a career that has truly been my passion and has truly given me purpose in life.
Awesome. Thank you so much for sharing. I took a little bit of time yesterday to do a little bit of research on PubMed and GreenMed info for just searching for massage and stress and looking kind of what publications came out, and the results were quite incredible. So many scientific-based studies done for massage and stress, whether that's anxiety, postpartum depression, insomnia, autism, pain. So much research out there. And there's no question, especially if you have had a good quality massage in the past, that a professionally applied massage session can change so much your internal environment, whether that's physical or psychological. So, Kayla, in your experience, what types of psychological conditions can benefit, or you've seen benefit from massage?
I've definitely seen many psychological conditions benefit from massage, from depression to anxiety to postpartum depression. Also, post-concussion syndrome is another big one that has a lot of benefit from massage therapy. It's amazing. With what has been done with research, massage therapy has been shown to increase oxytocin. Oxytocin is a neuropeptide that mediates mood and social interactions. It's been shown to increase serotonin, to increase dopamine, and to decrease norepinephrine and cortisol, both two major hormones of stress.
Amazing. So massage, as you say, like in your own personal experience with clients as well, the science is going to back that up as well, that massage is going to take that individual into a parasympathetic rest and digest place where the body's actually going to be able to heal and create that homeostatic environment that, you know, we're kind of all looking for. Do you have a particular type of injury or issue that you see more of?
I wouldn't say a particular injury. However, what I do see a lot of is our chronic North American posture. A lot of us are sitting for multiple hours a day. What that does is it really shortens the muscles of the chest. It shortens the hip flexors and creates some stagnation in the abdomen. Serotonin, which is a major mediator of depression and mood, about I think 90% of the serotonin is found in the gut. So if you don't have proper gut health because you're sitting all day and you're not getting a lot of blood flow, or you don't have great kind of nerve health in that area, definitely you're going to perhaps be affected by depression.
Yeah, absolutely. I think that's a great answer. And I was just thinking, as you mentioned posture, I immediately put my shoulders back and try and sit up properly. But if we are like kind of slumped down a little bit, we're restricting our upper body and our abdomen, and we're going to be inhaling a lot less oxygen. And
Absolutely.
That's going to create a stressful environment in the body, because the body's like, what the heck's going on? Oxygen levels aren't high right now, slipping into that stress state that we spoke about. So absolutely, I'm sure the pain and injuries and discomfort that people come in to talk to you about, I'm sure one of the first things that you look into is like how someone sits or how someone stands and how someone spends their day.
Yeah, and that kind of North American posture creates a lot of pain throughout the upper back, mid back, even the low back. And as we all know, someone who's dealing with that general achy tension or pain in their body, that also affects mood. So helping postural awareness, helping to calm the sympathetic nervous system, bringing the body more into that parasympathetic rest or digest are all super important things that massage therapy can do.
Yeah, that's awesome. And I've personally had a couple of sessions with Kayla very, very recently, and I've had a lot of massages from a lot of different practitioners, and just taking that time in the beginning of our sessions to look at my posture and have the conversation around, how am I spending the majority of my day? How active am I? These are obviously huge questions, because you might be having a session for an hour with a practitioner, but there are many, many hours outside of that 1 hour therapy session that are going to really contribute to somebody's pain and ailment.
Yeah, the body doesn't lie. So I think it's so important to have that kind of postural view before a session to see and really just ask, like, oh, what does this body have to tell me? Because the body, it's just so incredibly wise and smart, and it will lead you to where it needs the treatment. Also, I think the health history is also super important. Just to know what goes on in that body's life day to day. What position is someone taking on a regular basis, any hobbies they have, any previous injuries, what medications, all those things really factor in to help create a really a treatment that is specifically for that one person, rather than just like a prescription recipe massage.
Sure. So the things that you discuss in your intake form and pre-massage, obviously so important into how you're actually going to apply the therapy session itself.
Yes.
Yeah, and some of those big factors, again, can you just repeat some of those? So like the big things that you look at before you even make contact.
Well, any major accident, injury, fracture, or operation, or major scars. For sure. Even if it doesn't pertain to the issue that that individual is coming in with that day, that really tells a story. And we often don't realize how these surgeries or accidents or fractures, how they can affect and impact the whole body. In Western medicine, I find we tend to divorce the parts of the body. We have a specialist for this one area or that area, or we're looking at a certain muscle. And really, the body is 360 degrees interconnected, head to toe, side to side. So we have to look at all of the body and look at it as a holistic being. And from there, I often feel like a little detective putting together clues from like I said, accidents, injuries, any illnesses that someone has had. Perhaps they've been bedridden for with a pregnancy for 6 months. That really impacts the body. Perhaps they've had digestive issues throughout their life. I want to know what's going on with the body that way. And then also very important is to know kind of what position the body's in from a day-to-day basis, if there's any repetitive strain or stress, how active someone is, and then also medications, what they're on, what they're treating, and if there is any mood disorders or if someone's experiencing any challenges with, if they're a woman, with their menstrual cycle.
Yeah, obviously everything's so interconnected, and I love the fact that you mentioned that, yeah, the body is so beautifully, it's just working together the whole time. I've got a personal a story with that, I broke my right clavicle playing soccer when I was 21, and for the last 15 years, massively aged myself there, but for 15 years I've experienced right hip pain, right knee pain, and right ankle pain. And maybe 10-15 years ago, I'd have that pain in a different area and just immediately think that it's isolated, and the pain in my right knee is because of my knee, and that's where it needs to be focused and treated. But no, I need to be taking into consideration I had a really serious accident that would have affected the whole of my body. And now I know that there are things that I do that affect my hips, that pull on my muscles, that affect my knee and towards my upper body as well. So yeah, everything being super connected, and knowing that pre-session is obviously vitally important, and obviously checking people's prior illnesses and medications as well is just part of being a responsible professional therapist. What percentage would you say of your clientele experience mental health related conditions, especially let's just consider now, we're in the early parts of 2021 after the most insane year? In a normal year, anxiety, depression, stress is high anyway. Have you noticed a big difference?
I would say everyone. 10 years ago, when I first got into practice, I was actually surprised at the amount of people who were experiencing mental health challenges. And now it's even more. Definitely, if not anything clinical, but definitely as the climate of our world has changed, as uncertainty has come in, everyone who walks through my door is experiencing a decrease in mood or is just expressing challenges that they're having, especially with their mental health. And I'd have to say anxiety, depression are at an all-time high.
Yeah, I think it's actually just walking around, it's really palpable, that energy. And I consider you a very energetic person. That's my experience with you personally and as a practitioner. And for people like that, you can just look or just feel a room or a person, and you feel that energy. And I feel I've got a little bit of that too. But and yeah, it's you can just tell that out there right now. It's just people are scared, people are anxious, people are stressed out, and whether that's massage or acupuncture or a workout routine, doing something active to self-serve, is vital now more than ever. Back to massage and the therapy. I personally think when I think of my main reason for massage and acupuncture and anything that I do for my body, back pain is a main reason I personally seek massage therapy, and I'm sure that's super common for a lot of people. are the psychological benefits that you mentioned, all those neurotransmitters that are exhibited during a massage, the happy hormones, we can call them, are those psychological benefits just this added bonus of being taken care of physically and emotionally during that hour session?
Yeah, I think the investment into mental health actually happens when you take that time for yourself. When either if you're paying it for by yourself, or if you have medical coverage, if you're taking the time to submit your receipts, to do all that stuff, it's all an investment into yourself. You're taking care of yourself, which is just an added bonus. And then, yeah, like a lot of people come in for back pain and then end up seeing the results of increased mental health.
Yeah,
and relaxation, really. I mean, if it feels good, you're going to have the tendency to do that again as well. So that's an added bonus of having people recognize that they're not just coming in to fix an injury, they're also coming in and getting extra added bonuses such as increased mental health.
Yeah, that's awesome. And we did our first ever podcast was on acupuncture, and how just being kind of sat in a chair or lying on a therapy bed, you can't go anywhere. And apart from like going to sleep or passing out asleep at night, usually quite late into the day, and after watching screens for so long, when do we ever really take that time for ourselves to sit or lie down and just be with ourselves? And we're going into an hour massage or another therapy session, you're kind of forced to take that time for yourself, and how wonderful that can be, that release, and to be taken care of by somebody. And especially when you get a really good practitioner that's got that energetic feel for you, I think that's really, really, really wonderful. And I've met some amazing practitioners who can really feel what's going on with somebody, like they've got this kind of added sense that we've kind of spoken about. Can you talk to us a little bit about the kind of energetic frequency aspect to massage? Because we've had a few conversations on this podcast already about like that energetic frequency side of things, that every cell of our body emits a frequency, and different parts of our body, when it's out of sync or out of line, that we can consider that pain or dysfunction or disease in some aspects. And what we're trying to do is create homeostasis, and we're trying to create like that frequency to be in rhythm and in time in how it wants to be. Can you like touch on that in regards to massage?
Yeah, there's many rhythms in the body. I think the heart emits its own electromagnetic resonance. It's so cool. Like, it's autorhythmic. So even if it was disconnected from your brain, your heart would still beat with and does with no neurological input. You've got the resonance of the neurological system and the brain. And then you've got this neat rhythm called the craniosacral rhythm, where you can palpate kind of the flow of cerebral spinal fluid. So massage therapy is so incredibly powerful because it helps entrain all that. It helps bring it down and definitely sedate it to a point where if it's too high, it brings it down. If it's too low, it brings it back. And I believe actually there is a lot of research on that. And energetically, I mean, yeah, you do just as a practitioner feel things. I think I often get the question of like, oh man, is your body sore after massaging for so long? And actually, as a practitioner, if I take care of myself and I do yoga and go to the gym and meditate on a regular basis, my body actually feels quite fine. But what I do find that the aspect of my job that can get pretty heavy is that energetic aspect of it, where sometimes things are heavy and you do really, you can really take that on and can really feel that. So
are you talking about like when somebody's coming into you and they're energy is just like whether it's down
Yeah,
or
whether
off.
they're having chronic pain, or sometimes you can have what's called an emotional release, where you're massaging a part of the body and someone will just start to experience deep sadness, or they'll just start to cry, or they'll laugh. And it's a real, you can't really, there's nothing to really explain it other than they're just having an emotional release. Often the person who's experiencing it doesn't even have a particular memory or a why about it, but it's almost like this burst of energy where their body just releases whatever is being held in that area. And it's such an honor to be able to witness. And it can also be pretty intense.
Yeah, I can absolutely imagine that. That's really cool. How much of what the client does, your clients, how much of what they do outside of the treatment room, plays a factor into their own healing? Because
absolutely, I think it's everything. I've had people come to see me, and then all of a sudden they've started to engage in other activities in their life, such as going to the gym or going for a walk on a regular basis. Maybe it's going to counseling, and just those things that people do outside of the treatment room. Absolutely, I've seen basic miracles happen with people. Sometimes I feel like a keystone habit, like just like the habit that everything else hinges off of. So sometimes someone will start going to massage, and then that feels really good, and they keep on investing their time and their money into that, and then they want to do more things that make them feel good. They want to do more things that add to that frequency of healing and well-being. And once that kind of train starts going, man, it goes. And some of the things that I've seen have been absolutely amazing.
That's really cool. Yeah, when it comes to, obviously there's so much personal responsibility. If you're actually going to take the time to make an appointment and go and see somebody for something you're experiencing, that's a wonderful thing to do, but the responsibility doesn't end there. You're going to go and see a practitioner for an hour a week, maybe. There's so many more hours where you are you're still with your own body, that body that may be experiencing pain or discomfort or something, and you've got this big responsibility on yourself to do the things outside of the session that's going to help complement it.
Yeah, and I think with massage therapy, one of the true gifts of it is bringing awareness. So often we're disembodied, and especially with depression, that's a main symptom of it, is that we're not really feeling our body as much anymore. And I think with our really fast-paced, instant gratification kind of lives that we live, we end up being a little disconnected from our body and disconnected from the messages that it has for us. And massage therapy, that touch really helps us re-engage with what is our body telling us? What are we actually feeling? I can't tell you how many times I'll be drawn to an area and start massaging it, and my client is like, oh wow, I didn't even have any idea that area was sore. So definitely, I think a real benefit of the massage is that not only are you investing the time, but you're also reconnecting with your body, and you're able to have more awareness of what's going on. And then you're better able to make decisions in your life that will further serve that.
Great. And how important do you think it is to commit to going to see a therapist on a regular basis, rather than you're going for back pain and you book a massage because you heard that could release some of it, and some people might be disappointed that their back pain is not completely eradicated after an hour session. How important is it to to keep up the practice and create that relationship with a therapist?
Well, here's my terrible metaphor. We often treat our cars better than we treat our bodies. If you're just driving your car, once a week, and you're within the speed limit, then maybe you don't need to have a tune-up all the time or change the oil. But if you're putting some good mileage on your body, or you're driving a sports car, then you're going to want to have a little bit more have more tune-ups, have more oil changes. And that's where I think complementary alternative medicine comes in. If you are if you have more injuries, if you've had more surgeries, if depending on what's gone on in your life, if you're playing lots of sports or if you're sitting for many hours through the day, you're probably going to want to have to do a couple more tune-ups on your body. And that means seeing your whatever works for you. I mean, I think it's great to try many different practitioners and of many different therapies and find the things that, I mean, your body knows. You will know what feels good for you and what is really helping you, and you will know what maybe doesn't feel so great. So finding a few practitioners and a few therapies that really help you and continuing to engage in them. But I always tell my clients, like, your body will know when to come back. And so staying connected with your body and making those appointments when your body feels ready.
Awesome. Yeah, again, like, it's a big commitment to, if your pain or discomfort is at a point where you know it's giving you those internal messages to actually go and do something about it, you need to really be honoring that message from the body. And yeah, it's a self-commitment thing.
Yeah, and not only that, I mean, often these things, these chronic things that we come up with, back pain or chronic overuse syndromes, it didn't take a day or a week or even a year sometimes to create them. So it's going to take a little bit longer to fix them than just one session. It's a great start and it's a great awareness. And yeah, definitely asking for homework from your practitioners is a great idea, I think, as well, because like we talked about, having that agency to help yourself out. And often, especially as a massage therapist, we do a lot of work with giving people remedial exercises so that they can be empowered to take care of themselves when they're not in their session.
Do you think there are any, or if there are one, or I'm sure there's one or many, but like, is there a specific other therapy that really complements well with massage?
Well, in my experience, yes, I'd say really great registered acupuncturist it can work wonders. As well, a really good chiropractor.
Acupuncture, nice.
Yeah.
I think obviously, in my experience as a nutritionist, I've often seen many of my clients, they like to go towards kind of like one practice and kind of stick with that, rather than being, dabbling in different areas to, support different parts. So, someone might be taking care of your nutrition, but, maybe someone else you need some support with your physiotherapy or, that acupuncture piece, so there's amazing practitioners all over the world now in pretty much every city. So, yeah, not just getting stuck on one practice. And I think I was going to ask you now about obviously you live and practice in Kamloops. Very difficult to do a Zoom massage. But for people who are listening who aren't in Kamloops and they're looking for a practitioner, a registered massage therapist, what kind of things should they be looking for? Because there are good therapists and there are bad ones.
Yes. So definitely, like we talked about before, someone who really takes the time to do a thorough health history. Someone who actually looks at and palpates your body before the massage, who's gonna kind of see where your body's at right now. And I think when you're getting a massage, someone who, and I mean, we're all definitely, I have been guilty of this, but someone who doesn't talk too much. Someone who gives you the time to really sink into your treatment. I mean, there are times when people want to talk and that's great, but also to be able to really sink into your experience and take that time for yourself without hearing your therapist's story about their day or, I think someone also who engages the tissue of your body in a way that is respectful and in a way that works into it, rather than just like, when people have a feel for things, and definitely trusting your own internal wisdom. If it feels good, it probably is. And if it doesn't, it probably isn't. Yeah.
You can probably get a feel pretty much right away from meeting a therapist, whether, it's kind of going to go well.
Yeah. And someone who listens to you, I think is absolutely important.
Yeah. I think as any therapist in any modality, that would be key.
Yeah,
absolutely. That person's coming to see you because they need support, they need help, and they need that high level of respect that goes along with that. I'd like to talk about fascia. I think fascia is very, very cool, and I've heard it described in different ways. Can you give us a little rundown on fascia and what it is and how important it is to take care of it?
Yeah. Great. I love this. Fascia is amazing. So fascia is connective tissue. It runs through your body from head to toe. It surrounds every blood vessel, muscle fiber, individual muscle, bone. It's pretty much the structure of your body. We often think about our bones as holding the structure of our body, but it's actually the fascia. If you took everything out of every bone, everything out of your body and just left the fascia there, it would still maintain the form of a body. So you would be able to tell that that was a body. It's so incredibly strong. I think it's 3,000 pounds of pressure per square inch to move it. It's so strong that you could take the fascia from one body and basically hang a 1-ton truck off of it.
Wow.
Yeah. So it is incredibly important in our body. We're now finding tons of new things about it. I mean, we used to just kind of, especially in like a cadaver lab, they just take it away and not even look at it. But now we're finding more and more how integral it is to our body and to our structure and to our health. It actually transmits information from the body to the brain faster than our nervous system does, like multiple times faster.
Wow.
Yeah. So,
that's really cool.
it's very cool. So fascial health, especially for me in my job is pretty much everything. And what I do as a massage therapist, I mean, working with myofascia, is to really help it be functional, help it have continuity, and help it be movable pretty much. It can get stuck on itself. It can get stuck on things. The body is so smart. It wants things to be easy. So if your body is sitting in a certain position or has maintained a certain position for any length of time, especially over 10 to 12 hours, the body will start laying down little fibers of fascia to help basically lock it down. So if you're not engaging in regular movement, your body will actually lay down fibers to help you stay in that position, which, I mean, isn't exactly that functional and can add to a lot of pain syndromes or a lot of postural dysfunction.
Yeah, that makes a lot of sense. If we were to be, we don't really want to be, it sounds like that's a defense mechanism to, lay down those layers to keep that rigidity to kind of protect, but obviously we're not built to sit and be stuck. I would really,
a man who I deeply admire, his name is Gil Hedley, Gilhedley. He's an anatomist, and he actually has a YouTube video called The Fuzz, which shows exactly that if you're not weak of the stomach.
Sure, I'll make sure there's a link to that in the show notes, but I can kind of imagine already what kind of video that is.
Yeah.
But that kind of stuff's super fascinating.
So fascinating.
No doubt about it.
Yeah.
Can you talk to us a little bit about, you've obviously got there's relaxing massage, there's deep tissue, and obviously we've got different types of tissue, whether that's, just the skin, fascia, muscles, and even deeper, there's obviously some potential organ palpation when it comes to massage as well. Can you talk to us a little bit about maybe the difference between, you focusing on the fascia of a muscle organ area of the body versus muscle, that deep muscle?
Yeah. So when you're working with muscles, you're more working with Swedish massage. You're working to affect the muscle spindles. You're working to affect the Golgi tendon organs. And so that's more your traditional massage with oil. You're doing a lot to increase circulation, stroking techniques, a little bit of trigger point release. And so that will help to really lengthen the muscles. With fascia, it actually is it takes a lot of patience, because you have to put the time in to work with the fascia. So to affect the fascia, you'll have to do slow, deep, sustained pressure. Generally, you're not working with oil, and you're you're assessing the tissue with your hand, and then you're engaging into the tissue and finding the areas where it wants to go, and then the areas of restriction. Then you would engage the tissue into the area of restriction and hold till you find a release. And often that takes anywhere from 2 to 3 minutes.
Wow, that's like a lot of attention in that one area. And yeah, you're having to just like really, probably be really subtle with that touch and being really cognitive of like those like really subtle, small micro movements.
Yeah, the touch isn't exactly subtle. Anybody who's had myofascial release, it can be actually quite intense. Often there's like a heat response generated, but definitely you do have to be very, as a therapist, be very tuned into the subtleties of the body, for sure.
Cool. And just to kind of wrap this up in regards to the nervous system, obviously here at Truehope Canada, we're all about trying to promote mind and body health. And every single, structure that we've spoken about when it comes to the human body and massage, everything is obviously innervated with nerves and connected to our central nervous system, which ultimately is going to really predict whether we're going to be in a stressful, sympathetic fight or flight state, or we're going to be in a kind of more rest and digest. And obviously we very organically and naturally fluctuate between the two nervous systems. And when it comes to a fight or flight response, we're only really designed to do that in a very short period of time. But it sounds like massage really beautifully connects, dependent from what I hear, on the therapist, who really can make that connection with that person and that body and that energy and that frequency that person's experiencing. Really long-winded question, but can you kind of like maybe sum up or wrap up the whole idea around massage, touch, and how that can ultimately engage that rest and digest parasympathetic nervous system response? That type of therapy really helps, because not many people book a massage therapy session because they're feeling anxious. It's usually pain or aches, but obviously what we've spoken about today, it can really support somebody's physical and mental health to just lay there and really be connected with a good practitioner.
Yeah, so definitely the connection with the practitioner. However, above that is the amazing research that we have to show that massage therapy, medium touch massage, helping to decrease the hypertonicity in the body, the tension in the body, increases oxytocin, serotonin, dopamine, and it really decreases those stress hormones of norepinephrine and cortisol. They did a study where they tested people's saliva before and after, and continued to test it for a few weeks. And
before and after a massage.
Yeah.
Yeah.
And the cortisol levels in their saliva markedly went down. And cortisol is a huge moderator of the fight or flight response in the body. On top of that, I do really want to speak to the fact that anxiety and depression are physical. We feel them in our body. And sometimes I feel like it's kind of the chicken or the egg question. What came first? Did what we're doing in our lives create the tension in our body, which then created the loop of the kind of adrenaline axis, where we're having that adrenaline we're really aware that we're feeling tense, our body's producing that. We can really affect one or the other. You can affect the adrenaline and the cortisol response by letting go of the tension in the body. Often with depression and anxiety, you have that chest tension. Mm-hmm. You're not breathing fully. I think one of the first things that happens when you go into a fight or flight response is that we really breathe apically. We breathe to the top of our chest. And with massage, we really can encourage the muscles of respiration to relax so that we're able to take nice, deep, full breaths. So we're creating a really great physical environment for that fight or flight to not happen.
Wonderful. And obviously feelings of stress, anxiousness, depression, these things, I believe we're supposed to experience them on some level, but it obviously gets to the point where we're having this significant loop that's always always on play, and it gets to, it can get to a position where we're in an environment, or we're thinking something, or we're feeling something that's immediately triggering us to get into that state. And there are so many wonderful ways that we can help ourselves get out of that continual kind of subconscious loop. And I've had a personal experience with this. Massage therapy is without question one of those things. I just love getting on that bed, closing my eyes for that hour, and just like all I need to do for that hour is just focus on my breathing and working with a practitioner. And I think maybe we can just touch briefly on the breath as well, because I've had massages in the past where, sure, it's been painful, but my breathing is, rather than working with the pressure, I'm kind of maybe resisting, and I'm like locking up a little bit, and I can definitely feel that that's just definitely not helping. But now I kind of like to breathe with the pressure, and I kind of need to like let not just the area go, but the areas around it, to kind of make it a little bit more loose, and just allow that area to just like, okay, listen, it's okay, we're in a safe space here, we can let go a little bit here, just so we're actually getting that focus, that attention, and that therapy on that area. Can you just touch on a little bit about like how important it is for you as the patient, but also the therapist, to work with you in regards to like making sure that you're breathing properly during that session, because there can be quite painful moments, especially when it comes to massage.
Yeah, it can definitely be uncomfortable, but if the person on the table isn't able to let go, then the massage therapist is just fighting their body. So I think it's definitely a lot of communication between practitioner and client to really help to bring mindfulness, bring awareness to the area, and for the therapist to be able to encourage their client to breathe through it and to relax into it, and to know when too much is too much. I really, no pain, no gain is really not something that actually applies to massage. And there can be some times where things are uncomfortable, but you gotta be able to breathe through it, and you can't be tensing your muscles towards it. Those are my two main things that I always tell the people who are on my table, is that like I just said, if you're having to change your breath and you're holding your breath, or you're holding your muscles to my touch, then you need to let me know. It's too much. Yeah.
Wonderful. I think that's a great place to wrap this up. Obviously, yeah, you're in Kamloops, so yeah, you obviously you're here practicing. How can people get hold of you who are in Kamloops?
Yeah, they can email me. My email is Kayla Ruddock, rmt@gmail.com. That's KaylaRuddock, RMT@gmail.com.
Awesome. And say I am in Victoria, and I can obviously Google RMT near me or in Victoria, and I'm going to get a whole list. That can be actually quite overwhelming, that whole bunch of people. But say, for example, if I wanted to call up and actually have a conversation with that therapist or the spa or whatever they're working at, if I'm not, is there anything I can ask them about like the session or the therapy, just so I can find like the right practitioner, because massage isn't cheap, and I want
Yeah, no, I think that's a great question. I think it's definitely depending on what you're looking for and highly individualized. But I would say ask around, especially if you're looking for more of a relaxing massage and you just need to get, stress, we all know is a killer. So if you need to really de-stress, ask your friends, ask people that ask people that are doing well with their body, and that are investing in their body, who they found that works well for their body, and also kind of what kind of massage it is, depending on what you're looking for.
Beautiful. Kayla, thank you so much for coming and talking to us today. I really enjoyed that.
Thank you, Simon. It's been a pleasure.
Thank you, everybody. I hope you enjoyed that episode. We will be back next week. This is the official Truehope Canada podcast, Truehope Cast. I hope you enjoyed the episode. All show notes will be in the description below, so you can get access to everything we've kind of spoken about today. If you want to connect with Truehope Canada, we've got a brand new website, brand new podcast, brand new blog. We've got some really great stuff happening for the new year. You can go to truehopecanada.com to get connected with that. And yeah, we're on Facebook, Instagram, MeWe, YouTube, all the usual sites. Lots of content coming out each and every day. So don't hesitate to jump in there and get connected. This has been the True Hope Official Canada podcast. Have a beautiful day. Goodbye.